For today's IPPSR Public Policy Forum on K-12 education during the COVID pandemic. I am Matt Grossman. As the director of the Institute for Public Policy and Social Research, I'm pleased that we're able to provide some up-to-the-minute current issues on the new challenges we're facing as a state. And as a elementary school parent in the Lansing area, I am pleased to hear from some of the experiences of those districts that are opening for in-person education, as well as the statewide data on the choices that districts are making. We're pleased to have the continued support of the W.K. Kellogg Foundation for these forums, and thanks to all of you who could be with us. Next, I'd like to introduce our Associate Director, Arnold Weinfeld, who will be moderating today's panel.
Thank you, Matt, and welcome again to everyone for joining us today. Before we get started, and before I introduce today's speakers, just a reminder of some of our Zoom ground rules. All attendees are muted. You can ask questions through the Q&A box and or the chat box. We prefer the Q&A box, but questions can be asked. We'll ask a couple of questions as they come in of each presenter as they finish, and then of course during our roundtable discussion. Again, thank you for being with us. So let me take a moment to introduce our speakers today. Our first speaker will be Dr. Katherine Strunk. Dr. Strunk is the Clifford E. Erickson Distinguished Chair in Education and serves as faculty director of the Michigan State University Education Policy Innovation Collaborative and a professor of education policy. Her current research is focused on working with local and state education agencies on studies to help them inform policy and practice. Dr. Nikolai Vitti is superintendent of the Detroit Public Community Schools. Dr. Vitti was appointed superintendent of the state's largest school district in 2017. Prior to that, Dr. Vitti led Duval County Public Schools, the 20th largest school district in the nation, with approximately 130,000 enrolled students in 200 schools. And he was previously Chief Academic Officer of Miami-Dade County Public Schools and Assistant Superintendent for the Miami-Dade District, as well as Deputy Chancellor at the Florida Department of Education. And Dr. Keith Smith, Superintendent of Kingsley Area Schools. Dr. Smith has served as Kingsley Superintendent for the past 10 years. He started his career as a high school chemistry teacher before transitioning to a new role as principal, spending 10 years in two Michigan communities, Memphis and Clio. And Dr. Smith, I can say very happily, bleeds green and white. He earned all 4 of his degrees from Michigan State University. So thank you, Dr. Smith, Dr. Vitti, and Dr. Strunk for being here. And Dr. Strunk, why don't you kick us off?
Great, and let me just share my screen. I cannot share it until you're off, Arnold.
My apologies. There we go.
Okay. Okay. Thank you so much for having me today. I'm thrilled to be here. I wanted to talk with you about some research that we've done here at EPIC on the K-12 education response in Michigan, as well as just bring a slightly more national picture to the work. So I'm going to take about 20 minutes to walk through that. A little bit of background first on EPIC. So for those of you who don't know, EPIC is a nonpartisan independent research center located here at Michigan State University. We're devoted to what I call research with consequence, which means that we work with state and local policymakers and practitioners to answer the questions that they find the most pressing using the most rigorous methods we possibly can. We think this is particularly important right now in the middle of a pandemic, that we're working very closely with state and local so that we can make sure that we're addressing their questions, because there's a lot going on, and the more evidence we can bring to the conversation, the better. So, let me switch this. Sorry, not letting me switch. There we go. Okay, so today we're going to talk about 4 different questions. First, I'm going to talk a little bit about some of the greatest concerns about the provision of K-12 education during the pandemic that's kind of in the national conversation. And then I'm going to talk a little bit more about what different states are doing during the pandemic with relation to K-12 education, with a focus on Michigan. This is based on some work we've done in collaboration with IPPSR. And then I'll focus on what Michigan districts plan to do last spring. We looked at all of their continuity of learning plans that they were required to write. And we also surveyed educators in all the districts across the state. And then also, what did Michigan plan to do this fall? So based on their extended continuity of learning plans from August. Okay, kicking it off, some of the kind of research and practice-based concerns that have been part of the conversation about K-12 education and during COVID. I think the first thing that we've all talked about and we all know that is the top on my mind is that we're pretty convinced at this point that the pandemic has and will continue to widen the disparities that already existed between different kinds of kids and different kinds of schools and districts across the country. There was inequity to begin with, and the inequities have been exacerbated. And we need to continuously think about that as we go throughout this entire pandemic and kind of deal with the things that are happening post-pandemic when we get there as well. One of the things that is contributing to these inequities is technology. So technology right now is a key resource for families who are learning from a distance or who may start learning from a distance again. If students don't have access to internet and electronic devices, their learning ability is restricted. This is actually always the case, but it is especially the case when we are having schools and districts who are learning remotely or kids who are learning remotely, or they might go back to learning remotely if we hit a higher phase, say in Michigan or things like that. In particular, we're worried about kids with disabilities, homeless students, English language learners, I should also say early learners, kids who don't yet have the capacity to read, struggling readers. These teachers are very worried about these kids and they need extra support and guidance to be able to provide those kids with the kind of instruction that they need during the pandemic. It's beyond just academic outcomes though, right? And so one of the things that have been really starting to be talked about in the research and the national conversation is that it's also the socio-emotional and mental health needs of these kids. It's their nutritional needs. The kids get a lot of their needs met inside school buildings between the hours of 8 and 4. And when you don't have a typical school day, when you don't have the ability to interact in the way that we normally would, we have to really be thinking about what other supports that kids would normally get inside school buildings, we should be providing them with outside of school buildings, whether or not through the schools or community resources. And last, given all that I just talked about, I think it's pretty clear that we will need more money, not less, to address these inequities. And so we need to continuously think about what we're going to do to provide all the things that we need to provide to the kids who are inside our K-12 schools during this time and after. Okay. So I'm going to just start with one study that I think is really important to set the stage. This study was done by some folks at NWA, which is a benchmark assessment group. They provide benchmark assessments to districts across the country in almost every state. And they use their data from previous years to consider what typical learning looks like in a given year, including summer learning loss. So they test in fall, winter, and spring, and then the next fall. So they're able to say, here's how kids typically progress over the course of the school year, and then how much learning they lose by the time they come back to school in the fall. That's shown for grades 3 through 7 in these solid lines on this graph. This one is for math. What they then did is they said, assuming that we stopped instruction in the middle of March for most districts in the country, what would happen if we just assumed a parallel line for learning loss at that point? So we didn't assume that there was any extra losses or any extra gains. We just said if they were to have stopped school in mid-March, and stopped going into school buildings and then had a sort of a traditional learning loss rate over the course of the next 6 months, how would they come back to school in the fall? And then they also added in a couple other estimates where they said, now let's think about what we would know about like missing days of school for snow and things like that, and how that contributes to extra learning loss. And those are shown by the dashed lines. And what you can see is pretty alarming. These predictions suggest that for math, they'll end this summer and start the new school year with only 1/3 and 1/2 of the traditional learning gains you would expect in a given year in math. So we're having kids come back having learned only 1/3 to 1/2 of the previous year's content on average. It's a little less alarming for reading. This is the reading projections, but it's still not great. With these projections, it looks like we could expect kids to come back in the fall, having learned about 2/3, retained about 2/3 of the learning from an average year. So in this context, what are states doing in relation to K-12 education during COVID? I'm not going to focus too much on the different kinds of data we're using. Just want to put this up there. I know this is going to be posted on the IPPSR site, so you'll have access to this. But we use a bunch of data that we collect by ourselves as EPIC, also with IPPSR, and then we also tie it to administrative data in Michigan and US Census data. So here's what we know that states have done. And this is just a couple of pullouts. We do have a database on both the IPPSR and EPIC websites. We find that almost every single district, almost every single state, while they made unilateral decisions in the spring about when to close and school buildings, 47 out of 50 states deferred to local districts on reopening plans for the fall of 2020. The 3 that did not were Florida, which decided that all schools had to go back in person, and New Jersey also in person, and Arkansas dictated hybrid. The other 47 states left it down to their locals. Very few states have provided much guidance to schools and districts about how their operations should go. So in terms of things like required hours of instruction, graduation requirements, promotion and retention decisions, attendance and grading, those have also been left to the locals. And there hasn't been a lot of support or guidance given to them by the state levels to tell them how to operate. In terms of funding, some states have made cuts to their K-12 education budgets, notably Colorado, Georgia, Missouri, and Mississippi. Colorado cut more than $500 million in funding to schools. Georgia cut $1 billion in funding for K-12 schools. Missouri cut $131 million. But a lot of these states also then kind of filled in the blank with the CARES Act funding that they brought in. So for instance, Florida used $1 billion in CARES funds to help schools reopen. Here's how Michigan looks on those 3 areas. So Michigan's return to, as you all know, Michigan also left it to the locals on whether or not they should reopen. The Michigan's Return to Learn roadmap was actually one of the most comprehensive sets of guidance, and they largely provided suggestions and not requirements for what districts should do upon reopening. Michigan has provided legislation about attendance, instructional hours, and benchmark assessments through HB 5912 and HB 5913. And as we know, Michigan's K-12 education budget was level funded this year. Okay, so at the district level, these are based on our spring continuity of learning plans that every district was required to write and submit to their districts, ISDs and MDE, as well as by our response rates to our surveys that went out to all K-8 educators in Michigan. I want to make sure that I've got some terminology here because it's different from last spring to this fall. Last spring, we were calling hybrid instruction that was happening both virtually and hard copy. So this is not opening the days for half of the days of the school week or things like that. Hybrid was kind of when districts were saying we're providing both online instruction as well as hard copy instruction. But you can see here with the green bar, that a little over 40% of districts plan to provide instruction in the spring that was entirely online or virtual. Another almost 40% said they would provide some sort of hybrid virtual and hard copy. Relatively few districts said they were going to only provide hard copy media for instructional reasons in the spring. Here I flip that graph on its side and I compare it across districts that have low, medium, and high broadband internet access. And what you can see is pretty obvious. The districts with high and medium broadband internet access are much more likely to provide virtual instruction, so again, all online, or some sort of hybrid, and much less likely than the low broadband districts to provide solely hard copy instruction. This matters because we know from the research that to have engaging instruction with kids, you need to be engaging with them in an interactive way to at least some portion of their school day. And when they rely solely on hard copy, it was much harder to get that accomplished. And so it looks like the kids who are in areas with low broadband internet access had that happen for them the most last spring. So we asked teachers about the challenges they faced when they went with technology and virtual instruction last spring. And what you can see here in these green bars is the percent of teachers who reported that they faced a moderate or challenge to a moderate or to a great extent. Teachers reported substantial challenges with technology and virtual instruction. So over 3/4 of teachers said that consistent internet access for students was a challenge to a moderate or to a great extent. Nearly 3/4 of teachers also expressed that facilitating student participation in virtual class activities and a lack of technology training for students were challenges. They also expressed that facilitating student-to-student interaction in a virtual class setting was hard, as was the lack of available technology for students and a lack of technology training for remote learning tools. So we show a lot of data on these slides. This is a question that we asked about what resources would you need to help you with your virtual learning experiences? Again, this is last spring. We asked them to rate the kind of how helpful different things would be, to a not at all, to a small extent, to a moderate, and to a great extent. And so what you see here is on your left, the principals in our survey, and on the right, the teachers. We centered it at 0%, so you can see the split between those who said things would be helpful to a moderate or great extent in the green and dark blue. And on the left side of those 0% lines, in the teal and the purple, you see to a small extent and a not at all helpful. And what we can see here is that in particular, over 3/4 of educators wanted models of digital classroom practices, virtual training resources on how to effectively use digital learning strategies, digital platforms that provide learning content, and ready-made lessons to deliver online. Fewer educators, so less than 40%, felt that they needed help to get internet access or reliable home computer or device for themselves. So when we read the plans last spring to see what kind of instruction they were providing kind of in all this, we categorized something what we called was direct engagement. And direct engagement is actual in-person, or not in-person, but it's a teacher on live synchronous work with kids on the other side of the computers. Notably, only 9% of the plans last spring actually specified how many hours or lessons of direct instruction kids would get a week. And they averaged about, of the 9% that did, they averaged about 11 hours per week, or 5 or 6 lessons per week. That would be sort of direct instruction between students and teachers. 16% of plans specified expected time for independent learning and schoolwork, so not sort of in collaboration with the teacher live, and that averaged about 12 hours per week. I don't show it here, but we did see that younger students were provided with less instructional time and fewer lessons. And then this graph on the left here in the green shows that rural districts planned for fewer hours of live instruction and lessons. So it doesn't surprise any of us that educators were incredibly concerned about the impact of COVID on kids. Again, this is from the spring survey. What you have here is we asked teachers how concerned they were about a number of different things. And this is the principals on the left, teachers on the right again. And it's the same exact breakdown. The green and the blue show concerned or extremely concerned to the right of the 0% lines, and the purple and the teal show not concerned and somewhat concerned on the left of the 0% lines. For both teachers and principals, you can see that the far majority of educators were concerned about students missing instructional time, students returning to school buildings behind in literacy and other content areas this fall, the long-term economic impact on students, and students missing crucial services and support. In particular, we saw that teachers were concerned and reported challenges with helping special needs populations. And so 64% of teachers on our surveys told us that they were having challenges with providing supports and services to students with IEP and 504 plans. In 70% of the plans from last spring, districts did note they were trying to provide accommodations for students with IEPs and 504 plans, but often there was not a lot of detail within that. 39% of teachers reported challenges with continuing to provide supports and services to English language learners. Only 26% of plans discussed how they were going to accommodate ELs. And then last, 69% of teachers reported challenges with continuing to provide access to literacy and intervention services last spring. Only 4% of plans addressed accommodations for students with what's called, quote, reading deficiencies under the Read by Grade 3 law, or IRIS. Okay, so now what did Michigan districts plan to do this fall? In collaboration with MDE, we coded every single return to learn plan in August. And we coded for instructional modality in 5 different areas. So we said, what kind of districts are coming back fully in person? The number of districts coming back fully in person, coming back fully remote or online, so no in-person buildings. Hybrid, so they're coming in between 1 and 4 days a week in person to school buildings, and the rest of the time is at home. And then we also looked at districts that were providing the option for in-person, so you could either be in-person or hybrid or remote, and the option for hybrid. You could either be hybrid or fully remote. So here's the district breakdown. We did code for 823 districts, all the districts that provided return to learn plans in August. We looked at districts in phase 4 and phase 5, which was required by the plans. And then we coded the modality based on which region that the districts were in. So if they were a phase 4 region, we coded what they said they were going to do in phase 4. If they're a phase 5 region, we coded what they were going to do in phase 5. We did it for both LEA districts, traditional public school districts, and public charter school districts. What you can see is that about 86% of districts overall offered some kind of in-person instruction to kids in the fall or plan to as of late August. 16% of those districts were going to offer fully in-person instruction. 43% were giving kids an option to be fully in person. 10% plan to give kids an option to be at least hybrid, and 17% were giving kids a hybrid option. Only 12% of districts said they were going to be fully remote. And here's what the breakdown looked like in a map across the state. So you can see that there were clusters that were geographically located for the purple, which are the fully remote only areas. And those are located around the Lansing area and the Grand Rapids area in particular. And then here's what it looks like for student counts. So we took the student counts in these districts just to show you that for like instance on this top row, 16% of districts said they'd be fully in person, but that's only 9% of students in the state. So those are the smaller, obviously usually more rural districts. On the flip side, on the bottom, you see fully remote only. 12% of school districts were going to be fully remote as of August, but that was 19% of kids. And going the column over, it was about 20% of the state's most economically disadvantaged kids that were going to be fully remote. So what can we think about from all this moving forward? There's a lot of takeaways, and I'm sure we'll talk about them later. A couple that I wanted to hit quickly. First, I think it's critical that we consider how to equip all students with the necessary learning materials to enable them to actually engage in the kind of whatever kind of instructional modality they're doing. So if they're going to be remote or hybrid, they have to have online access. They have to have electronic devices that work, that are theirs solely. And if they're going to be back in person, how are we going to give them the necessary equipment to do that? We have to continue to focus on both instruction and student support services. Teachers and principals are worried about the gamut. It wasn't just about academic instruction, it was about mental health as well. And this is particularly the case for lower achieving and economically disadvantaged students and for younger students. We should be continuing to try to build on our current efforts to provide direct instruction and frequent contact between students and teachers, whether that's in person or remote. And we also need to make sure that we're supporting our teachers and educators in all this. We have not trained our teachers to be teachers who teach in a remote setting. And so making sure that we expand our access to PD for these educators will be critical. And then last, and this is the thing I think we should talk about the most, is how do we keep equity of opportunity at the forefront when we're planning for instruction going throughout the 2021 school year. I will leave it there, and then I think we'll come back to questions later, Arnold.
I've got one question right now that I think I'll present, Katherine, and I think you did go over this, especially with the breakouts you gave in those last few slides. But the survey was conducted on Michigan school districts, is that correct?
That is correct.
And was it educators, principals, superintendents, and what was the response rate?
I'll go to my backup slide, which I was ready for this. So we did talk to almost 9,000 educators in Michigan, or surveyed 9,000 K-8 educators in Michigan. We did cover 752 districts. So I showed you a map of the districts there that you can see where we have coverage from. It's pretty widespread across the state. This was only 16% of all eligible teachers and 12% of all eligible principals. Again, we asked them to answer a survey in April and May of 2020. So we were amazed that we got this many people in the middle of all that. And the survey sample is fairly representative of Michigan educators. We did have higher proportions who were female, who were hired in the last 5 years, elementary certified, and endorsed in ELA.
Super. Thank you very much for that.
Sure.
Thank you again, Katherine. And now we'll turn to Dr. Keith Smith, Superintendent of the Kingsley Area Community Schools, to share his perspective and experiences as a superintendent in a Northern Michigan rural school district on reopening of schools. Dr. Smith?
Yeah, thank you. So as you said, Kingsley is a small Class B school. We are the district just south of Traverse City. I have about 1,500 students, three buildings, an elementary, a middle school, and a high school. To talk about our reopening, unfortunately, I have to go back and talk about what happened when we shut down. And obviously that was sprung on us pretty quickly. Being rural Northern Michigan, getting people fed, if we think back to that, obviously the running all the grocery stores was my first concern. We used our school buses to go door to door and deliver meals to each child in the district. It's not going to sound like a lot. We ended up doing 160,000 meals from March to June. To put it in perspective, Traverse City beat us to the headline. They got 100,000 meals, but if you took a proportionality of their 10,000 kids, while it's fantastic that 100,000 meals from Traverse City went out, proportionately, they would have served over 1 million meals for the same number of students. And so it was very clear to us that that was a big concern of our families, getting the food. If for some reason we used our buses and we missed, people would call us and say, hey, could you run the food back out, to the families. And so that was a wonderful program right until we had a couple dog bites. And that was my first real interaction dealing with a couple different state departments. We had to get some waivers to be able to use coolers to drop the food because per the nutrition guidelines, you have to hand the meal to a kid. Otherwise, it doesn't count for reimbursement. And then the health department had to allow for the use of the coolers. To kind of show that Lansing is not terribly attuned to Northern Michigan, one of their first suggestions after the dog bite was stop going to everybody's house, just use the bus stops. And I chuckled and I said, done. You do know in Northern Michigan, every house is its own bus stop. We only have a couple common stops. And so there's a little bit of a disconnect, but the department worked very well to help us get through that. And you could tell part of the article when I talked about kind of a disconnect for the social emotional part. The teachers would do car parades for kids' birthdays, all this stuff that lots of districts did. They'd wear costumes to develop the food, and people would come out, support. It was all over Facebook. And that was kind of when I first started to see how much kids were missing out, being home. Obviously, we had students and we had counselors and principals, checking in with kids, but it was pretty clear to us that aside from missing out on the academic, which is a substantial piece, certainly the social emotional part was taking a toll on the kids. Important for Kingsley, we had 3 student suicides about 1.5 years ago, back to back to back. Definitely something we've focused on. But part of that, with the MDE, closing us, we certainly wanted the kids back. We were handcuffed. Every district was. When you can only provide 2 hours of material a day, when you're told not to provide new material, when you can't grade things, or certainly you can't hold it. I guess you could have graded it, but you couldn't count failure to do it against a kid. Certainly, kids were falling behind. And at best, we were trying to keep kids engaged in learning activities, but we all knew that they weren't really progressing in the curriculum. My own 2 daughters. One of my children's very introverted. She thought the world for once was finally right. She got to stay home, didn't get to interact with people, and she loved it. My other one is very extroverted, plays sports, social butterfly. One of my children reverted back to self-harm, and it was the one who would have supposedly liked it. She actively said she enjoyed not going to school and staying home and all that, but she did start self-harming when she was home with her mom. Thankfully, that has stopped now that she's back in school. That has subsided. So I did have a firsthand look of how that impacts children, or can impact children. When we talk about connectivity in Northern Michigan, at my own house, if I set my phone, if I'm not careful which side of the couch I set my phone on when I'm at home, I will or won't get phone calls. I had a parent contact me. He did have a cable at the bottom of his driveway. His driveway is 1 mile long. To run the cable to his house is $18,000. And he was asking, were there any programs to help with that? And so when you get up here, I appreciate every area has its challenges, but simply you can't necessarily just hand hotspots to people and say, hey, these kids can connect. You can't have, the cable companies were fantastic, allowing students access. But again, in some parts of the state, you can offer it, but if we can't get the signal to the house, it certainly doesn't serve its purpose. So with that, very quickly, we made the decision to return early. The governor allowed for an early start. We felt very strongly that we wanted to get our kids back in front of us as quick as we could to start trying to make up for what they had missed out on. It's important for us to try to maintain 180 actual student days, not teacher days that we're counting as instructional time. And at the same token, by starting early, it did allow us to not go deep into June for the next school year. We had 80% of our families take us up to return in person. Only about 20% started off online. With the return to school plan that I think MDE did a fantastic job on, lots of suggestions. It really did, I think, help guide a lot of really good decision making. But and again, in Northern Michigan, my community was very strong about being masks optional because we're in zone 5, so it was not a requirement. So we are mask optional. And just from my own estimation from walking through the buildings, classrooms, I would say only 10 to 15% of the kids are wearing masks. So from a policy consideration, at least in Northern Michigan, if there's a desire to have kids with masks on during the school day, that has to be a state mandate, not an optional, because certainly many communities, mine included, want the choice to be able to make that for their own child. So obviously I was greatly concerned when we were back in school all of 3 days before I had my first positive COVID case at high school. And that really got me to second guess, did we make the right decision? Despite having all the right intentions of getting folks back, certainly you wonder, did we make a mistake? The health department was fantastic, working through the quarantine and isolation. It was a high school kid who had been at school for 2 days. And so we were greatly worried with the number of kids who were going to be quarantined. It ended up, the health department really did use a scalpel, and it ended up resulting in 12 other students being quarantined. So at least the initial fear of, one positive case knocking out, 100 kids at the high school didn't prove to be true. Part of the frustration, I think, as time has gone on is a little bit of the inconsistency. And I wouldn't want to be with the health department. They're doing a great job. They're doing as much as they can. But because each situation is so unique, there seems to be an apparent inconsistency for which teacher or kids are either returned to school, have a quarantine period, have a different quarantine period. And so that causes a little bit of angst amongst the teaching staff. Small towns, people know, even though you're not releasing any information, people know a lot about each other's lives. So a little bit of animosity amongst the inconsistentness of the different health departments. Though I think I wouldn't want their job for anything, and I think they're doing a fantastic job. But that mixed messaging does make it difficult for us. So of the specific challenges that we faced, this one's going to seem kind of silly. Per the return to school plans, you have to use an EPA approved cleaner to disinfect the desks multiple times throughout a day. We are actually on our 3rd chemical. The original one we were using wasn't on the primary list of EPA approved cleaners, so we picked a different one that was prominently on the list. With obviously the warning signs that are on it. There was somebody who did make a state complaint that we were not using the right chemical. We actually are dealing with a state inspector right now. And though I think he's doing a fantastic job, he is zeroing in on the fact that the cleaner may not be on the surfaces for a full 10 minutes. Again, from a policy perspective, with high schools having 5 minutes of passing time, desks being cleaned, 5-6 times a day. I don't know, I would be reticent to see how many people really are getting it on the surface wet for a full 10 minutes while you've got kids in the room. But that's just something that we're dealing with, which seems like a silly thing that picking the right chemical in the application, the extended learning plan just said it had to be an EPA approved cleaner, had to wear a mask, face shield and glove, and that they needed to be cleaned at the high school, between classes. So that was a little frustrating that something that silly occupied that much of our time. Getting supplies has obviously been a challenge for, I'm sure, everybody. We purchased or tried to purchase 300 Chromebooks this summer. We were close to being able to do 1-to-1, 3 through 12. And with the purchase of an additional 300 Chromebooks would have made that happen. Despite the company saying, yep, they're in stock, obviously we're still waiting like everybody else for those. The challenges for, just getting the equipment. Kingsley, 1,500 kids, we got 7 55-gallon drums of hand sanitizer, 30,000 masks, 8,000 gloves. You know, and I think that's been a challenge for everybody to decide how much material to have, how much supplies to have on hand, but not waiting too long to try to reorder. But obviously a fear that I'm going to have 55-gallon drums of hand sanitizer that doesn't smell particularly great for years to come. Sports from Northern Michigan, of course, right? Beans, balls, and buses tend to cause superintendents the most amount of problems. Those are what people comment about. Different challenge than Dr. Vitti would have downstate, obviously in a different area. We opened up to sports, and the inconsistent messaging out of Lansing has caused some issues and hard feelings up here. We were very thankful that our children were allowed to start sports, and that was fantastic. Our rates were pretty low, and so our kids started off with no masks. But then during the last month or month and a half, obviously that changed. So the kids now have to wear masks while they're participating in sports. Right up front, that was a bit of an issue, you know, with 500 spectators. We made a decision that we were going to let football, band, and cheerleading all come, knowing that knocked out parents being able to see, you know, their kids. And so as people from a policy perspective, as you're thinking about how this applies at a state level, yes, it's important for parents to be able to see their children play. You know, but please remember that a senior only has one chance at a senior year, a child only has one chance at their third grade year or whatever. You know, and this is what those children are going to remember. So I thought it was important to try to make it as student-centered as possible and free up tickets, or free up having the band there, the cheerleaders, and that's just as important as the actual football game to me. And thankfully now that, again, in this zone, they moved that to 1,000 people, dictated on spacing and all that. So that problem has largely solved itself. Other considerations, I believe, and I don't want to speak for Dr. Vitti, I think we have the same union. I think we're both FT, Federation of Teachers. Sounded like his agreement involved compensation to get teachers to return in person. My agreement was the exact opposite of his agreement. We ended up negotiating with our union for people who are teaching both in person or online. I'm sorry, I should have said, I'm a district that allowed a choice. You can either return in person, you could go online with our teachers, because I think it's important to have that relationship and not just dump a kid into, I apologize for the value judgment, not place a kid in an online program that's not tied to our teachers. We wanted to make sure that we were still doing that, and understanding in a highly competitive schools of choice environment, you have to allow flexibility between in-person and online. If you said you have to be online only, up here, if something happened where they wanted to come back in person, there's plenty of districts who would take them. And conversely, if you said, hey, if you started in person, I'm not going to put you online, again, everybody's got their own program right now. So if you didn't allow it, somebody else would. So by using our own teachers, parents are able to transition between in-person instruction or online instruction as their comfort level changes. If there was an outbreak, they could make that change. The fear that people were going to ping pong back and forth between online or in person really hasn't happened. We have had people transition from in person to online or vice versa. We haven't had anybody ping pong back and forth yet. And so that was important to us. But that agreement, so to compensate for the additional online teaching and students, for us was $278,000 out of a $15 million budget. To help put that in perspective, it's roughly equivalent to the last 2-year contract that we settled with the teachers. And so it's a significant bump in compensation for folks that are teaching online kids as well as in person. And that's, I think, interesting to point out. I had heard a rumor that the Detroit deal was different, and of course, different area. You know, you're going to have different issues. One of, this is where I get the shepherd's hook or things thrown at me. One of the things from a consideration standpoint is it would be probably pie in the sky, but it would be amazing to me to have the ISDs, you know, run the virtual program. You know, in a highly charged schools of choice environment, if the ISDs ran the online program and then returned the unused part of the FTE back to the local district to which the child resided, you know, we wouldn't all be trying to, burn out our staff, you know, provide excessive choice for our kids. And I don't know that that's a long-term solution, but I think in the short run, it would have helped many schools, because if you get too much smaller than Kingsley, and out of the 900 school districts in the state of Michigan, Kingsley's almost in the middle, or probably exactly in the middle. So for smaller districts, a lot of the hybrid options and things were born out of necessity, because they didn't have enough teaching staff to be able to pull both off. I got really lucky in elementary. I have 4 sections in person, one teacher teaches online. That works well until you get to middle school and high school, where you have one chemistry teacher who's got to do them both. So I think there are things for collaborations, and in fairness to Dr. Vitti, if not the ISDs, larger districts would be particularly well suited to be able to help provide that for neighboring districts. So instead of, during the pandemic, instead of fighting over kids, and I do appreciate that they split the funding 50-50 to help knock down any changes in enrollment, I think we kind of missed a great opportunity for some collaboration that would have helped all educators and teachers and help stabilize the funding, instead of competing at a point of scarcity. My last interesting point for the policy considerations, and it's very personal, that testing is not going to be the answer. And despite early on me making some fairly public comments that I was appalled that the minor league baseball team could test all of their athletes and we couldn't get testing for teachers, and that was true at the beginning of the year for us. I actually just returned to work this week after being presumptively positive. I am dating a doctor here in Traverse City. I was with her for the week before she was positive. She tested positive twice, and I spent the entire quarantine period with her. I passed both of my COVID tests. So she was positive twice. I was negative twice, despite living with her for 2.5 weeks. So any notion that the testing is going to be the save all of this situation, I certainly, from my experience, though the health department moved me to presumptively positive, it scares me a little bit. Testing is good, but at the same token, when I know firsthand that the results are not particularly accurate, I don't think we want to put too much eggs in that basket.
Thank you, Dr. Smith. Greatly appreciate that perspective and views. We've got a couple of questions, but I think they're pertinent to both you and Dr. Vitti. So I'm going to give Dr. Vitti a chance to present his views and perspective, and then we'll get to the questions for both of you. Dr. Vitti?
Thank you. Thank you for inviting me, and thank you to the opportunity just to hear some of the research and from some of my colleagues. So hello, everyone. I'm Dr. Vitti. I'm the proud superintendent of Detroit Public Schools Community District. This is now my 4th full year. I had to remember that. I'm proud to serve over 50,000 students who are in our school system. We have over 100 buildings. And this has been challenging. I feel in many ways that once the pandemic hit, it has been one long day, or maybe one long week at best, just constantly dealing with a series of issues. And I feel that that's always been the case with trying to reform the district, but this has been unprecedented. It's a bit of a cliche word, but it has truly been unprecedented and challenging. With that said, I'm proud of the way our employees and many others have tried to put their arms around our families and the community, and especially our children, in these hard times. So I'm going to just walk us through what we have done and the challenges that we have faced since the pandemic hit. So when the pandemic first hit, I was one of the first superintendents to call for the closure of schools. I did that because it was we were starting to deal with issues in the city first, or at least that was what was publicly known with the Detroit Pistons and a couple of incidents. And even those were starting to trickle into the school system. And it was becoming very clear that an infrastructure was not in place to deal with positive cases. And we didn't know enough about COVID from an education schooling point of view to make sure that we could keep children and employees safe. And it was becoming maddening very early on how how to trace for social contact, limited PPE at that time. So that's why I had called for the closure of schools. And obviously I think that was the right decision to make. When we made that decision, we were at a disadvantage immediately because we did not have a way to give students devices. Many of our students did not have devices, and they didn't have access to the internet in their homes. Although we had learning platforms that could be used online at home, not curriculum, but really more supplemental in reading and math, only about 10% of our students were logging in regularly to access those programs. So that, and those programs could be accessed from kindergarten all the way to 12th grade. So in the first couple of weeks, it was very clear that there was a device issue, and in Detroit, there was a internet connectivity issue. So although majority of our families have phones, iPhones, Androids, those devices are not ideal for learning. And although they may have data plans, those data plans are not broad enough, rich enough to take the bandwidth necessary to participate in daily online learning, especially knowing that a lot of our families have multiple siblings or children. So that's another challenge with just having one device. Who do you give it to? And how do you really effectively run a schooling process? So we printed packets. We selected lessons at every grade level, mainly in reading and math, somewhat in social studies and science. And we printed thousands and thousands of these packets. We identified about a third of our schools as distribution sites for food and packet distribution. Throughout the course of the pandemic, so since from March into the summer, we provided 1 million meals to families throughout Detroit. And that just gives you a sense of food scarcity, of poverty in the city, but how important the district played in a role to fill that gap. And we worked well with the city to organize and coordinate those feeding efforts. And I publicly have always done this, but I'll do this because it's a public event virtually, is thanking our cafeteria staff. That was at the height of the pandemic where everyone was legitimately afraid to go out. We had the shelter in place. We paid them quite a bit more, almost double what we were paying them in hourly wages, but they did it because they cared about our families and our community. And that was when everyone was home. So that wouldn't have been able to happen without them and several of our central office staff. So as the pandemic continued and we went through the end of the school year, we knew that with the pandemic obviously continuing, we had to do something dramatically differently from an online learning point of view. So we engaged the business community, they stepped up, and we ended up raising about $20 million to provide all DPSED students with a tablet with embedded internet access. So we purposely tried to find a device that could solve the device issue, obviously, but also the connectivity issue. And we were able to do that. And so we used philanthropy along with some CARES Act money that we received at the federal level to pay for the internet access. And that continues even beyond the 6 months, or will continue beyond the 6 months that we committed to. Then we had to figure out how to give those devices out because people were afraid of leaving their homes. So this happened late spring, early summer. We used those same distribution sites. Families came to pick up their device. We also then started our first wave of home visits, and that's been very important for us to engage our families. And I don't think it needs to be said, but maybe reminded that at the height of the pandemic, obviously our city was hit the greatest throughout Michigan and really throughout the nation as far as positive cases, but unfortunately death as well. And so our families were very reluctant to leave their homes. And so we went out to them to ask them, did they prefer face-to-face or online in the fall? And we also went out to them to let them know that they could pick up a device at no cost. So that's really how we were able to distribute the devices. And then in the summer, I began a very difficult conversation about reopening schools. And so I took the position I grew up in an immigrant working class family. My mother raised me and my sister really on her own, and with the help of my grandparents. And I appreciate research. Obviously, I have a PhD. It's important, but I didn't have to go very far to know what this was going to look like for working class families and those that are even more disadvantaged. I could only imagine going back in time and imagining my sister and I being at home and learning online, and how challenging that would be for my mother, who didn't graduate from high school but went on to get her GED, and with work constraints. So I took the position that we needed to offer a face-to-face option to our children. I didn't do that haphazardly. Unfortunately, when I was having that conversation, the president came out with this mandate that we had to open up schools with no funding, no plan, no COVID strategy, national plan to contain the virus. And we got lumped into that conversation on a political level, not really a strategic conversation. It became very political. And it was, if you're opening schools, you're with the president. If you're about closing schools, then you're not with the president. I don't support the president, didn't vote for the president, won't vote for the president. But I did believe that at the minimum, we had to offer an option of face-to-face. I didn't believe that the district needed to mandate it, but I think it was our responsibility to meet our parents and families where they were. And that was an equity issue for me. If middle class and upper class parents send their children to private schools, which are open, or can create education pods where they are hiring retired teachers or other individuals to teach their children the curriculum, then I believe that our most disadvantaged families and students should have the same ability through traditional public education, because it is the vehicle for equal opportunity. And that's even in a pandemic. And I also felt that a lot of our parents were the bus drivers that continued to run the buses in the city. A lot of our parents were the ones stocking shelves. Our parents were the nurses that were treating the sick during the pandemic. And I just felt that it was a matter of civic reciprocity that in a pandemic, then we serve children educationally, face-to-face, if that's what it took. We were not haphazard and about thinking about reopening schools. That for us started in the summer. And we were really one of the first large urban school districts and districts anywhere in the country that opened up face-to-face in the summer. And I did that because we know we were losing learning time because of the spring, but we also knew that our families and children needed us. So I didn't assume that. I asked parents. And I asked teachers. So we needed 170 teachers based on, if memory serves me right, about 3,000 parents saying they wanted face-to-face. And when we asked teachers, 300 signed up to teach face-to-face, and we only needed 170. So that right there told me that there were a group of teachers that were willing to do it. We were very intentional about reopening schools. So we went well beyond, this was even before the return to learn legislation came out. So we were reading, the best practices from the CDC. We were looking at Michigan's restart or safe restart plan, which was linked to businesses. We were looking at what American Federation of Teachers had issued regarding reopening up schools. And we implemented all the best practices, everything. So our employees had to be tested. We used temperature check machines. We did verbal symptoms check process for students when they came in. We used all the signage as far as social distancing, hand sanitizer outside of classrooms in front of the building or at the entry point when students come in. We trained all of our employees on COVID safety. We trained all of our students on COVID safety. And we required masks for employees and students throughout the day, kindergarten all the way to 12th grade. And so of the 3,000, if I remember right, half went online and half went face-to-face. And this was an option to parents. And we ran summer school. At that time, the protesting started in Detroit. A lot of the individuals that were protesting were teachers, part of an organization called BAM, by any means necessary. They've been a group of agitators way beyond me during emergency management, etc. They're a part of the union, but they do not function in concert with our teachers union. They're a fringe part of the union and of the teachers group. And they went very heavy on an anti-open school campaign, to the point of using signs that students would die if they went to school, that, you know, I was a child murderer, that the school board didn't care about children. And this sent a shockwave through the city, and even got national attention. And, you know, from the beginning, I completely understood where any teacher, any parent stood about the challenges of opening up schools. But unfortunately, it became more of a political conversation, not one that was really based on research. For example, the American Federation of Teachers was clearly saying that schools should not open unless the infection rate is 5 to 10%. Well, right now in Detroit, our infection rate, and people don't know this, is only at 2%. And during the conversation about reopening schools, it was about 4%, 4.5%. Meanwhile, large urban school districts in other places in Florida were opening when, you know, unfortunately and inappropriately, infection rates were at 10, 15%. With the COVID strategies in place, we move forward. BAM sued the school district. We went to federal court. There was a judge that was on the way to retire that ruled that you could run summer school. The district was implementing all the best practices, but we had to test students. We were strategically and philosophically opposed to testing students because we felt that it was a disproportionate and an unfair burden placed on them. Meaning, again, if you can go to a private school, a private K12 school and not test, why should you test to enter a traditional public school? So it was more philosophical. And at that point, universal testing and the use of universal testing was now starting not to be considered best practice, that instead maybe random testing was a better way to do this, not universal testing. And there were also parents that objected to testing because they didn't trust the test or the testing process because of historical misuses of testing and experiments done mainly on African-American children and citizens. So we did end up testing. We found no outbreaks or high rates of infection in our schools. In fact, the positive test rate was lower than the city's rate at that time. So that showed us after 2 weeks of summer school that schools would not be a hotbed of COVID transmission or outbreak. And so I already knew that would be the case because I knew we would be faithful to the COVID strategies, but that confirmed that. So as we moved into the fall, we had very difficult conversations with the union about how to open up schools. And it took a lot of negotiation, and we ended up landing on a letter of understanding that gave preference to teachers and ancillary staff, so guidance counselors, social workers, nurses, to pick whether they wanted face-to-face or online learning. So at the same time, we did a survey of our parents. 80% of our parents said they wanted online learning, 20% face-to-face. So when we opened up schools, we opened up all of 100 buildings. They all remain open. Our administrators are coming to work face-to-face every day. Our paraeducators are coming. Our cafeteria workers are coming. And all of our schools are open as learning centers. They're providing breakfast and lunch to all students who are coming in face-to-face or through the learning center. We're also feeding online students if they come to their school to pick up breakfast or lunch. Our learning centers function in a way in that if the family wanted face-to-face, but the teacher picked online, then the student can come to school every day at normal hours. They can bring their tablet, or they have a laptop at the school. They log in, a paraeducator is there to support them if they have questions or issues as they go through the learning process. And so all of our curriculum now is fully accessible online. We're using our own teachers, not contracted services, to provide online learning. We're using Schoology, which is really the same platform that other suburban school districts use in the area. So I'm proud to say that we are now a one-to-one district, student to device ratio. All of our online, all of our curriculum is accessible online. And so we have had only about 12 positive cases with students. We've had no outbreaks in Detroit in DPSCD, defined by 2 or more individuals being infected with COVID at a school site. We've had 2 or more, but there's been family-based, which doesn't define an outbreak. All of our positive cases are online, linked to the school. We notify all of our families and our students when there's a positive case linked to face-to-face or online learning. So overall, it has gone well. We committed every 9 weeks to ask our parents whether they want face-to-face or online. So we're in that process right now. The numbers are slowly increasing as far as the demand for face-to-face, but not as much as honestly I anticipated. The fear of COVID in Detroit is extremely high because families saw loved ones pass away, loved ones who were sick, and they don't trust the federal government right now. Right now the belief is that people are just safer at home and learning online. And that can be challenging for us as educators, but that's the reality, and we want to respect and support our families. I would say the greatest challenge for us is chronic absenteeism. That is not new in Detroit because of the reality of poverty and the history of racial injustice. But only 50%, usually 50% of our students struggle with chronic absenteeism by the end of the year. Right now, K12, at this point, about 30% of our students would be on the PACE or be chronically absent this early in the school year. Right now, we're trending at almost 60% of our students being chronically absent or on a PACE of being chronically absent. And that is 10 percentage points higher for grades K through 3, where online learning is the most challenging because it's parent supported. You have to have parents engaged at the K3 level, and that's hard for a lot of our parents. So we're surveying again. All of our schools are open. I wouldn't say that I'm pushing for face-to-face. What I've been trying to do is offer that opportunity when parents and children are ready to do that. And our employees, with that option, we're seeing an increase in their willingness to teach face-to-face as well, where right now almost about 35 to 40% of teachers are now willing to teach face-to-face or a hybrid of teach face-to-face and online. The last thing that I would say is we're continuing to try to refine our online schedule in order to reduce screen time and to be more flexible with the needs of our children and our parents. We're moving to a model of defining attendance by assignment submission and teacher time with teacher office time, rather than straight screen time through regular periods, at least at the high school level. We're doing regular period, our schedule, our online schedule mimics our face-to-face schedule with constant periods and time of engagement, although the screen time can be reduced even with that schedule being mimicked. So I'll stop there. Thank you for the opportunity and look forward to the questions and comments.
Well, thank you, Dr. Vitti and Dr. Smith. I've learned a lot here. I'm sure our attendees have as well. Katherine, as always, Dr. Strunk, thank you for your setting the table really with the research, and greatly appreciate the collaborative work that we do together between EPIC and IPPSR. I heard some very similar issues from the both of you. Connectivity, device acquisition, different resources. I don't think Dr. Smith has the kind of philanthropic or business wealth Dr. Vitti, that you were able to pull from to make sure that you got one-to-one. I mean, that's fantastic. I gather, Dr. Smith, right now you are not one-to-one because of the lack of Chromebooks. Is that correct?
Oops, sorry, I pushed the wrong buttons there. That is correct. We're close. We are at the high school and I think down to 5th grade, but 3rd and 4th, they're still waiting for devices to come in.
Okay. Well, one of the things you both are doing, though, is a hybrid model. Dr. Smith, it sounds like most of your students are face-to-face, some online. Dr. Vitti, the other way around. There's a school district here locally, Mason, which just went to hybrid at the lower elementary level. And already yesterday, there was a news report of teacher stress. So the question I have for both of you is, are teachers providing simultaneous in-person and online instruction to a class, or is there separation by hours or some other method?
Oh, how is it actually going? So while they are doing both in-person and online, it's not synchronous, that it's real time. That would have been my desire, would have been to live stream the class as it was done. You know, parents didn't choose online education because they're not happy with the education they're receiving, you know, from their teachers, local school districts. So I think for the most part, you know, people want to feel, even if they can't attend in person, they want to feel like they are. Unfortunately, you know, teachers were very apprehensive about live streaming their classes and lessons directly into homes, which I completely understand. That was a hurdle we weren't able to get over. And so for a large part, their lesson would be recorded, posted the next day, as well as additional supplemental materials. But the online does lag probably a day.
Dr. Vitti?
Yeah, for the with some rare exceptions, maybe at individual schools at an individual grade level, for the most part, teachers are either teaching just online or just face-to-face. That may change a little bit as we go into the second quarter, because as teachers are demonstrating through the survey that they're willing to teach face-to-face or a hybrid, we might have now more hybrid models where teachers at an individual school, individual grade level are teaching both face-to-face and online. But we're letting that happen at the individual school level. But I don't see that happening at a scale level right now. And I don't necessarily see that happen by the end of the year either at scale.
You know, one of the other things that struck me as being very similar to both your districts is, I think once again, the pandemic has shown how our schools are in many ways the heart of a community. Serving meals, resource centers. I mean, the both of you, certainly at different scale, but even my home district, also I helped deliver meals this summer. And that's so important. I want to thank you, and as you noted, Dr. Vitti, your cafeteria staff and all your staff for, you know, doing why they're in this business, right? I mean, you know, I like to say nobody gets in the school business, the teaching business, the support business for the money. That's for sure. You do it because you love kids, you love to help, and you love what to do. So I just want to thank you and your staffs for all that work. Dr. Smith, you just noted something about the Chromebooks at the lower grades as compared to the higher grades. One of the things I'd like to ask is, are we noticing learning lags by different grade levels? As I think someone discussed the differences for younger students as compared to maybe the high school students. I think Dr. Vitti, you said that it's very parent intensive at the K-3 level. And I hear that from parents in this area as well. Some of my colleagues, many of my colleagues have younger school age children, not a situation I would want to be in right now. So I personally am thankful that my children are older and on their way. But what are you seeing in terms of learning lags? Are you able to see anything yet?
I'm sorry, Dr. Vitti, if you want to go.
No, go ahead.
Of course we are, and it makes sense that it would be at the lower levels where their cumulative knowledge is just less. And so if a kid has only been in school, you know, 2.5 years because they got put on a pandemic and they missed that half a year. Of course, that's going to be a lot less compared to a high school kid who, has had 10, 11 years worth of successful education. So certainly when you talk about the fundamentals, for us, we really focus, I'm sure a lot of schools focus on reading, get in the elementary. If kids can't read, they can't learn. And as much as we target our most at-risk kids, those are the kids who are not getting the most robust reading support at home. And, to get better about reading, it is about spending a lot of time reading, helping people reading right at their level or one above. And so certainly as parents are, single parents are working, as the stress of all this, I appreciate that reading to your child at home or reading with your child at home has certainly taken a backseat for many families. So certainly, I think all districts have, I would guess, at the lower levels have noticed a bigger gap in learning.
Yeah, I would agree. We see it from an attendance issue, whether it's coming consistently to the Learning Center face-to-face or obviously at greater numbers and percentage, even online learning. So attendance is definitely more of an issue at the early grades. And obviously what needs to happen at the early grade level when it comes to explicit literacy instruction and math instruction is just not happening because of the way in which instruction is delivered. So that's certainly being seen academically and from an attendance point of view. On the flip side, the high school students, because they're older, their skill sets are more defined. They're starting to become more independent as young adults, as teenagers. I think they are adapting a bit better from an academic point of view through online learning. I think that our high school students are suffering more from a lack of social interaction.
So mental health issues.
The mental health issues, the isolation issues. From a policy point of view, if I'm thinking about next year, if I could wave a magic wand, we have to think differently. And the legislature was actually in this direction, and they moved away from it with focusing on K5 with a return and ESE students, special education. We don't care for special ed as the term we call our students with disabilities, exceptional student education. But I think that's a population we're not talking enough about. And I think that's the other population where when we think about what can policy do here, is try to get those students in schools faster. Because I think the high school students are adapting a little bit more. And let's be honest, our high school students interact more with each other, and they are more likely to be spreaders than our youngest children.
Yeah, I see Katherine shaking her head there. I know that we've had a lot of discussions regarding the population you just talked about, Dr. Vitti. My home school district, Waverly High School, has just started to bring back special ed students in pods and the like. So I know that we've had a lot of discussion on campus amongst colleagues, faculty, and researchers regarding that particular population. We'll get back to that in a minute, but I do have a question from someone regarding Voc Tech CTE programs. Dr. Smith, you noted your preference for the ISD maybe running online programming. How is that going? Are students still accessing those? Are they online? Many of those programs are clearly in-person programs that the ISDs put on in terms of Voc Tech and CTE. What are you seeing? What's going on in your districts regarding those?
So far, so good. Our ISD is comprised of 16 local school districts. They do run the tech center for us. They obviously, with the amount of kids coming from distant districts, they required masks. So far, the kids have done wonderful. To my knowledge, there hasn't been any cases at the tech center. Kids are adhering to all the requirements and rules, certainly. They want to be there. They're great programs, they're hands-on programs, and they've been able to reopen successfully.
Yeah, so we run our own career tech programs, and we've certainly enhanced that over the last couple of years. We gave students the option of, and the teachers the option of face-to-face or online. The vast majority took the online option. So we're still running classes for career technical education, but online. But, to your point, it's not the same because that requires more of the project-based learning, hands-on activities, but we're still running the classes, but online.
Okay. Katherine, you're the researcher here. You've got two very different and unique superintendents who run very different and unique school districts. Any question for them yourself?
I would like to follow up on this idea of special education students or exceptional students. This is a big issue right now that I think the researchers are beginning to really talk about, as these are the most at-risk students given the method of instruction right now, even if they're back in schools and unable to be in close proximity to their teachers. How do you all think about coming back to work with those students in the next 6 months and even after the pandemic is we're all back in our school buildings together?
Yeah, so when we think about coming back to school, I mean, I think about this every day, multiple times throughout the day. What is it going to take? So I'm thinking at a macro and at a micro level. On the macro level, at least in the Detroit context, I really think it's gonna take a new president. And I'm being, I'm not getting into the politics directly. I'm just being honest. There's just a lot of distrust with the Trump administration. And I think that is going to be a step in the right direction in our work to get kids back into schools. Then coupled with that is the faith that the community will have in the vaccination. And I think that's going to be the next big question. And that's also linked to who the president is and the administration. And I've come to the hard acceptance that we're going to try to do everything we're doing. Our school you can do a tour of the schools and see the COVID strategies in place. We have advertisements going on talking about what we're doing. And there's just deep distrust and fear right now. And so there's a certain level I can control that. And then there's another level of I can't. And so to your question about our ESE students, that's linked to it. But I would say the next step is getting our employees more comfortable with face-to-face teaching. And I think we're moving in that direction. The survey numbers for Q2 is showing that. But I would say, even if we're continuing to reduce class sizes, in our agreement, we have no more than 20 and less than that, depending on the size of the classroom. I think that's another way to have students feel more comfortable, and families and teachers. But inevitably, we're going to talk about resources, right? So, the more we do that, then you got to have a balance for that for online, because you're taking from Peter to pay Paul from a teacher resource issue. And right now, we're good for this year's budget, but I'm worried about next year's budget, from the national economy to the state economy, and how much revenue is going to be generated and what impact is that going to have. The only reason why our budget is even this year is because of federal dollars that were used to plug the holes. If those federal dollars aren't there, we're going to be in real trouble. And so then we can't even imagine smaller class sizes, rotating schedules, and all that if we don't have the right resources. So I know everyone hates when superintendents constantly talk about money, but if without money, you can't do things. So it's just a reality of what we're facing.
Superintendents, local elected officials, yeah. I mean, when your business is people, it takes people to run those programs, and so that does take money. I'm going to ask one final question, then we'll see if we have anything more from our attendees. Dr. Vitti, you talked about how 80% want it online. Dr. Smith, your community wants to be, face-to-face. Only about 10% you thought of the students were wearing masks. What is the attitudes of parents and students regarding masks? Are they you know, are students accepting of others that are wearing masks, those that are wearing masks, accepting of those that aren't, you know, so on and so forth?
That's a great question. I'd like to start by saying, I know Dr. V and I provide a very interesting dichotomy of different districts, but certainly we live in different areas, and you know, certain communities are affected much greater than others. So if I was down in his neck of the woods, you know, the decisions I made would likely be different. And likewise, if he was up here in northern Michigan, I'm hearing his passion for education. Certainly, I suspect some of his decisions may be different as well. I think that's a very important distinction to make, just the differences in the local communities. The community up here certainly would tend to lean politically a little different than what has been expressed. And certainly mask wearing is viewed as a personal choice, you know, and an overreach, you know, for the mandate of it. And that's predominant from the community, which is why we did a mask optional. I have had a conversation with Dr. Rice following my COVID case in the article. I said, you know, if you want people to wear masks in northern Michigan, that has to be a state mandate. You know, you can't make it optional, but encouraged. Again, due to the personal liberties and freedoms and that bigger argument being more prevalent up here. And predominantly you're not getting elected in the Traverse City area unless you are a Republican. Look at all our state representatives. And so the community very much was in favor of, you know, masks optional. Kids are kids, you know, kids are kids. And I hate to say kids can be mean. I'd love to tell you that they're supportive of all kids wearing masks, but I think that would probably be inaccurate or remiss. My own, again, I like use my own children as a barometer. And I said, you know, sweetie, my youngest, you know, you can't have the superintendent's daughter running around without a mask on. It was dad, nobody else is wearing it. And the compromise was she agreed to wear it in passing, you know, in the common areas. So it is not well accepted up here. And again, for that to change, that something would have to change out of Lansing in terms of taking it off my plate being an option, because again, we do work for the community, we do serve the community, and that is widely the community belief up here.
Well, let me turn to that for a second. And I you know, politics and policy and politics, fine line, but I had a note here, state mandate versus leaving it to the locals. So you're both smiling. You know, and I don't want to put you guys on the spot. You're both in tough spots, but it seems to me, and this even goes back to the business, it involves not just school districts, but involves businesses too. Would you rather have the state mandating or leave it up to locals? And, you know, because we just had a package announced yesterday by legislative Republicans here in Michigan to allow decisions to be made by local health departments. Would you rather, as a school superintendent, have those decisions made to you, your local health department, or should the state just have a mandate or not a mandate? Any thoughts?
Sure, I'm not one to sit on the fence on that one. I'm a big believer in local control, and we should be able to make the best decisions for our kids. Now, with that said, common sense does need to take hold, and I appreciate that sometimes that's in short supply. And so I think the health department, the legislator needs to monitor, you know, if there is an outbreak and there's a district that for some reason is not choosing to do what is the best public health, then I think it's appropriate for there to be a provision to step in and do something. But the vast majority, you know, Dr. Vitti knows his community. It sounds like he's doing a fantastic job. You know, again, the people closest to the community and the problem are the ones I think most apt to solve it.
Yeah. You know, because of the initial disproportionate impact that COVID had on the city, it sent a message throughout the city that we had to do things differently. And, you know, that's why our infection rate is less than 2%, which is lower than the average throughout the entire state. And that's because for the most part, people have definitely abided by with the mask rule and social distancing. You know, not everybody, but I would say you go to the gas station, you go to the store, you go in restaurants, walking around, even people walking their dogs will wear a mask. So mask wearing in schools really hasn't been an issue. The kids are doing, even in summer school, you know, when I went to schools, I was interested in seeing what it would look like. And kids, for the most part, were being dropped off with a mask on that we didn't even provide to them. So really the issue with the mask has been the younger kids keeping it on. Just it's irritating, and you know, but that's really been the issue with the mask. Your question about requiring at the state level or locally obviously is a great question. It's, you know, the age-old challenge that we have in this country on just about everything. I would say, you know, when it comes to public health, I don't think that should be exclusively in the hands of local school districts. I think public health issues need to be more mandated at the state level and through the health department. However, transparently, although I would say that I agreed with, I don't know, maybe 90% of the executive orders that were issued by the governor, there were some that were contradictory. There were some that got really messy with, you know, previous language being contradictory. What does that language actually mean? I think that could have been tighter. But again, that was also done in a time of, you know, unprecedented need of mandates without previous laws and guideposts at the same time. I actually hope that the legislature and the governor work better together. And that sounds maybe like a political statement, but you know, lawsuits against one another and all of this is not what that's not what the state needs. You know, there are points that I think both probably are right about, and whether it's schools, businesses, the economy, we got to figure out how to work together, Republicans and Democrats on COVID moving forward. And I'm going to say that directly to schools. So as far as schools are concerned, I would like to see stronger language about requirements on face-to-face, hybrid, and things like that, because it would give us more leverage to do what I think is best for kids. And I think, unfortunately, the legislature in particular kicked the can, and for political reasons didn't want to deal with the difficult issues. And I think the research presentation that we had in the beginning was evident of that throughout the country, that, well, you guys figured it out. Real easy to say in a pandemic with limited resources. So I'd like to see the legislature actually step up. Now that we have a year of educating kids in this pandemic, let's use the research to say who is most vulnerable, who needs face-to-face more than anyone else, and mandate that and fund it and let us implement it. And stop making us the ones that have to deal, mainly superintendents and elected school boards, balancing out these political issues and highly charged issues, and just do what's right, what's best for kids, and what the medical research says.
Well, thank you, Dr. Vitti, Dr. Smith, Dr. Strunk. I want to leave us with one thought before we close, and it goes back to something Dr. Smith just said. There's no doubt that the both of you bring unique perspectives from different parts of our state. But there are common threads that I've heard throughout your remarks. And one of them are on making sure that students have the appropriate tools to continue their education online. And that gets back to broadband access, device access. You know, Dr. Smith, great story about the family that needs $18,000 to put a cable line down their driveway. That's just not possible. And also distrust. There's distrust of different kinds in different communities, not just across the state, but across our country, and we all know that. And I'm hopeful that as we move forward, we're able to take a look at the things that are more similar between us rather than different. Educating our kids, whether they're in Kingsley, Detroit, Hamtramck, or Houghton, is about preparing our future economy and our future prosperity. So let's make sure, I agree, Dr. Vitti, that they have the right tools, they have the resources, whether in a pandemic, whether in face-to-face. And I again want to thank you all very much. Dr. Strunk, thank you so much for your continued work. Dr. Smith and Dr. Vitti, again, for your time here today, for sharing your experiences. Thank you to our attendees. And join us next month when our IPPSR Forum will feature an election review wrap-up. Thank you again to everybody.